So thank you all for.
One second, Doc. I haven't gotten the notification we're recording it. All right. Okay, we're rolling. Go ahead, Doctor.
Thank you all for joining us this afternoon. My name is Francisco Garcia. I'm the Deputy County Administrator for Community and Health Services. I'm going to give you a little brief update on where we are in terms of our pandemic response and in terms of our vaccination process. I'm going to try to make my remarks pretty quickly. But I do want to touch on a couple of things. I'm going to share with you my screen really briefly. And one of the things I want to share with you is the fact that, throughout the pandemic, we've gotten hit really hard, but during the last 5 weeks, we've experienced a week-over-week reduction in the number of new cases in Pima County. We believe that this is real, and we believe that this is continuing the trend that we're seeing in other parts of the country, but that certainly seems to be a little bit accelerated here. This timeline also, or this epi curve also has the various policy interventions that the Board of Supervisors and the Public Health Department have undertaken in order to address some of these issues. I think at this point we're on the mend, as it were, as it pertains to then the pandemic in this region. One of the things that we want to share with you too, because everything that we're doing right now is about vaccination. One of the things that we want to share with you is that we continue to make great strides. As of this morning, the state was reporting that we were just under 200,000 vaccines administered in Pima County. But a lot of people have expressed an interest in understanding where those vaccines are being distributed and exactly how efficient have our high efficiency pods been working. And as you can see, Banner, actually TMC, Banner, combined North and South, and the Tucson Convention Center have all been doing a tremendous amount of volume, as has the University of Arizona. I know that a lot of commentary over the weekend was about the U of A pod, and I'm be happy to answer some questions at that point. One of the things that we had to do because of the reduction in the number of vaccine doses that we got at the end of the week, beginning of this week, is that we had to make some very tough choices, and some of those choices involved us not being able to do some of our planned community pop-up vaccination events. And that is really unfortunate. And we made that decision precisely because our high throughput pods are working just so efficiently at delivering vaccine in large quantities that we did not want to sacrifice that. One of the things, for instance, that was impacted was none of our federally qualified health center partners, Marana, Desert Sanita, United Community Health Center in the rural areas, and El Rio in the Central Core, none of them got new vaccine for new vaccinations. So that is a real that was a trade-off that we had to make because of the reduction in the total number of vaccines that we were allowed to allocate. The other piece that is a piece of silver lining here is that, as you can see, the CVS and Walgreens federal partnership, this is the long-term care component, has now delivered more than 12,000, almost 13,000 vaccines to residents of long-term care facilities and assisted living facilities. We have there are a variety of facilities that were not enrolled as part of that program, and the health department has been very carefully identifying those facilities and actually sending our own staff with vaccine into those locations. And at this point, we've made really good headway and are halfway through that list of previously unregistered ones. So I think that is a major win. I'm going to show you the I'm going to show you the state's dashboard just really briefly. And I'll make it bigger so you can see it. So on the state's dashboard, you can see that, that for Pima County, geez, Louise. So for Pima County, we have administered 153,630 individuals have gotten at least one dose. A total of 195,899 have now received a vaccination of some sort or another. One of the things that is different from the way that the state is reporting now, instead of saying how many vaccines were actually delivered here to Pima County for us to administer, now they're putting the total allocation. That is both the vaccines we've asked for and that they approved us asking for, by the way, as well as the vaccines that they've actually delivered. And so the percentage looks a little funky. It's 87% instead of being 95% last week. So I just call that to your attention just because people want to know. The other thing that I'm going to point out to you is this is from the state's own website, and this is the week over week number of vaccines delivered. We have really been adversely impacted over the last 3 weeks by the diminished vaccine supply, and that's why you see this incredible plateau that has occurred. And we are hopeful and remain optimistic that at some point we will receive more vaccine supply and that we will be able to continue to have that curve continue to move up, because we certainly have the capacity. We easily have the capacity to deliver 5,000, 6,000 doses a day in this county. We just need the vaccine supply. And I realize that this is a complicated issue, and I realize that that is not entirely the state's fault, but it is a resource that the state manages on behalf of the feds, and we want to make sure that we do so most efficiently. I'm going to, the other thing that you heard during our, if any of you were tuned into the Board of Supervisors meeting, one of the things that you heard is that we're going to be opening up registration to individuals who are 65 years of age and older. That will happen later on this week on the 18th. Understand that we know that this is a complicated message, because on the one hand, I'm telling you that vaccine supply is restricted. On the other hand, I'm telling you that more people are going to be eligible for that restricted vaccine supply. One of the things that we were really working hard to mitigate against is the fact that with the opening of the state pod here at the University of Arizona, I am worried that people will start to get confused. And so rather than have different age eligibilities at different locations, we want to have uniform age eligibility across Pima County, even if it poses some challenges for us. We've made really excellent progress on the 75 and older, and then the 74 to 70, and we were actually poised to do that probably next week sometime. We're going to do it a little bit earlier. I think it's a good decision, but again, the devil's in the details, and the availability of the vaccine will be what makes things happen or not happen. I'm going to shut my mouth and let Jason turn it over back to Jason so that we can do questions.
All right. Thank you, Doctor. First up is Bud Foster, and then Danielle Kamara.
Yeah, Chuck did say this morning that 65 plus, but he only said at one time it was one quick line, and if you weren't listening very closely, it was hard to pick up. Now, you told the board this morning that the trend is real, that you're starting to get to a good place. We're in a positive phase. We're getting much better, much faster. And you're very happy about that. I'm sure a lot of other people are as well. You're going to start getting to 20, 30, 40% of the population vaccinated here fairly soon. A lot of those people, I had my first vaccine, a lot of those people are going to feel free after a year in lockdown. What kind of preparations are you making? What kind of warnings are you giving to the general public now that we're going to have, let's say, a 50-50 split? 50 people, 50% have been vaccinated, 50% are not, and people are going to start acting a whole lot differently than they do now.
Thank you, but the being vaccinated is not an invincibility shield, and does not really provide that kind of protection until you reach a critical mass in the population. That critical number in the population, we believe, is in the 75% range, 75 to 80%. When we achieve appropriate vaccine coverage in that wide a proportion of the population, then I do think that behaviors would be able to change. Until we do, and right now we are just over 15%. Until we do, it is really critical that people not get sloppy. It's really critical that people continue to stay home if they're sick, wear masks, wash hands, avoid crowds, and really avoid areas where there is exposure to a lot of different people. So that remains our recommendation. We have good data to suggest that those recommendations, those public health actions that were taken by Dr. Cullen and by the Board of Supervisors have had a real and measurable impact on the behaviors of people in Pima County. We believe that that's part of what's contributing to this relatively steep decline. I will take the next question.
All right, next up is Danielle Kamara, followed by Eric Fink.
Hi, Dr. Garcia. Thank you for taking my question. I was hoping to get an update on how many K-12 staff have been vaccinated, if you have the breakdown of first shots and both shots. And then also along with that, I was hoping to understand better why K-12 staff getting vaccinated is not a deciding factor in whether it's safe to open schools.
So Danielle, so I would refer you to the CDC guidance that came out on Thursday or Friday. So look at that, because that answers that question. That guidance very specifically says schools should open regardless of vaccination status of teachers for a variety of reasons. But to summarize it really quickly, the bottom line is that we have good strategies and mitigation efforts that can be put into place in school settings. And the decision to either have in-school learning or hybrid learning or all virtual learning, those are administrative decisions best left to educators. But purely from a public health standpoint, it is not absolutely necessary that every single teacher be vaccinated, not just vaccinated once, but vaccinated twice, and then wait the 3 additional weeks to make sure that that vaccine is performing maximally. If you wait that long, if you follow that logic, you won't be in school until next semester. So I believe that that's part of the rationale for that. The other part of the question I forgot, the first part.
It was just an update on how many K-12 staff have been vaccinated.
So I can tell you that we have vaccinated approximately 15,000 individuals who are in that K through 12 category, and given that number is about that the number of folks who fit that description is in about the 19,000, 20,000 range. That means we've actually achieved a fairly high percentage of coverage in that group. It's a hard number for us to put our arms around, but that's also part of the reason why we've seen a certain amount of saturation in terms of demand from the K-12 community. So we're feeling pretty good about the level of coverage we've achieved among K-12 educators and other educators, by the way, childcare workers too. Next question.
All right. Next up is Eric Fink, followed by Patty Mackler.
Hey there, Dr. Garcia. Thanks for taking the time. Wanted to ask you, we're getting word now that in the first two and a half hours or so, the state registration site being open down here at the U of A, all 12,000 appointments have filled up. I'd like to get your reaction to that and whether or not you have some concern, some worry going forward that vaccine supply remains extremely limited, yet so many people are looking to make an appointment now with the state-run pod that is opening.
Eric, first of all, thank you for letting me know that, because I'm not aware of that, but it doesn't entirely surprise me. Number two, this has always been, we've been very consistent. This is all about supply, and so this is what I worry at 3 o'clock in the morning when I wake up about is supply outstripping demand. Outstrip supply by a long shot. On top of that, Eric, I don't know if you guys are following this nationally, but the weather in the Midwest is causing some supply side issues in terms of the delivery of those doses that are being promised throughout the country. So we are tracking that very, very carefully because we are worried. As you know, we've operated our vaccination programs here in Pima County very tightly. That means that we don't have a stash in a freezer somewhere that we can pull out if that FedEx shipment doesn't make it into Pima County. So we are tracking that very carefully. Yes, it does worry me. I want people to have access to vaccination. That problem will be solved by the feds. That will not be solved here because ultimately it's a supply side issue. Next question.
All right, Patty Mackler, followed by Carly Tinsley.
Hi, Dr. Garcia. Thank you for your time again today. So please correct me if I'm wrong on this, but my understanding is that the state is taking vaccine for its U of A pod from the county's allotment. And is this concerning for you for any reason, or is it all a wash considering it's a pod we have here in our county?
So, it's one of these things where is the glass half empty or is the glass half full? And generally I tend to be an optimist, but if you look at the actual number of Moderna doses, for instance, that have been allocated, and I'll flash it for you right now. If you, I don't know, Patty, you tell me. This seems to me like a downgoing curve from our high water mark of 29,850. Now, all the only Moderna that we have that we've been allocated are 16,300. We know that another 1,000, 2,000 have been also allocated to the U of A for their pod. And all the Pfizer has been brought into the control of the state. They're allocating it directly to Banner and to TMC. I can tell you that TMC and Banner got a little bit less than they expected. And the U of A has gotten more of that Pfizer, of those Pfizer doses. Does this help the county? Every single time that a person is vaccinated, it helps the county. It really does. It helps all of us because we need as many people as possible vaccinated to get to that critical 75, 80% of the population. So it does, but it does make our life, it does make the management of this very super scarce resource even more challenging. We are, like I said, we had to make very difficult trade-offs that had we not had those 2,000 doses of Moderna not been allocated to the U of A, we would be allocating to our federally qualified health center partners. We would be allocating to our community pop-up vaccination events. So does it have a negative impact on us? Yes. Does it have an overall, is the net positive of more people being vaccinated worth that I think the jury's still out. I remain hopeful that we want to be in a situation where everybody is vaccinating to the maximum extent possible. We're not there yet because of the supply side issues, and I don't know that this makes our life any easier to manage. So I'll take the next question.
All right. Next up is Carly Tinsley, followed by Jasmine. Oh, sorry, Tim Eden. Oh, he's out. Then Jasmine Damaris. Yes.
Hi, Dr. Garcia. I had a quick question in regards to sort of our grocery store restaurant workers. It looks like Coconino County was able to move into that non-priority 1B group today. Realistically, when do you think we could move to that here in Pima County? I've had, several workers reach out to me who are just kind of frustrated because they were considered essential frontline people, and now they're kind of not at the bottom of the barrel per se, but they're feeling like, we're seeing people 5 days a week. Why aren't we being bumped up and being helped out? So kind of when do you think that can happen, and what do you have to say to them?
It is a very frustrating situation. And in relatively small counties where there's not as much population, yes, they are being able to move through those phases. I can't create vaccine that doesn't exist. I can't deliver vaccine that doesn't exist. If we don't get that vaccine in our hands, that vaccine doesn't get into arms. Currently, we have covered approximately 15% of the population. If you look at the demographics of the population that we've covered, it's been older people, and it has been healthcare workers. And we have achieved relatively good progress on both. But here in Pima County, the number of people, for instance, over the age of 65 is very substantial. And we still have a long way to go before we get all those folks covered. Folks who are essential workers, folks who are doing those kinds of frontline functions, we will get to them, and they will be served, they will be vaccinated before many other people in this environment. But we are not there yet. And I believe that the expectation that we're trying to set is we start thinking about those other essential workers in mid-March, mid and later March, to open up the registration for that side of the house. I think if you look at any of the major metropolitan areas, if you look at any of the large population centers, they're in the same boat. And again, at the end of the day, it's all about vaccine supply. Next question.
All right. Jasmine Damaris, followed by Mark Mangura.
Hi, Dr. Garcia. You've mentioned several times that the decreased allocation in vaccines has sort of impacted pop-up sites and mobile sites, which were very targeted towards disadvantaged populations and Hispanic populations, other sort of minority groups in the area. And so I guess my question is, since the county is maybe not doing as many of those pop-ups right now, are there any other efforts happening that are sort of helping to get these disadvantaged populations to these larger sites, whether it's through Spanish language information or transportation opportunities or anything like that, just working with other community partners to get these folks access to the vaccine?
Well, Jasmine, and just to be clear, it's not just minority communities. It is folks in relatively rural areas. It is folks who are elderly. You saw us do a pop-up up in Green Valley. Not necessarily a disadvantaged community, but certainly a community that skews to that greater than 75 age demographic. We need to take care of the people who have the most to lose. So that continues to be our ethos. That continues to be what we are doing. Yes, you're right. Part of what we need to do, and part of what we are planning to do, and part of what Mr. Huckleberry talked about is that we are figuring out ways of pulling some of the existing vaccine stock to be able to do those kinds of pop-up events. We anticipate, again, that we have such a good network of clinical partners, predominantly the federally qualified community health centers, that especially those that serve the periphery of Pima County, that is United Community Health Center, Desert Sonida, and Marana, that we're poised as soon as vaccine supply loosens up. These folks are ready to give out thousands of vaccines. And so what we're trying to do at this point, Jasmine, is to really concentrate on making sure that that capacity is there for when the spigot opens up, and understanding that we need to do a fair amount of outreach and education. But by the same token, you know, we have a limited number of appointments, and again, we can't create appointments when we don't have vaccine supply, and so that will continue to be one of the things that is going to be a challenge for us. I will take the next question.
Certainly, Mark Mangura, followed by Greg Bradbury.
Yes, hello, Dr. Garcia. The Biden administration recently, unveiled plans to start allowing asylum seekers back into the states, and Senators Kelly and Sinema both wrote a letter to DHS expressing their concern on the lack of resources that DHS has to, test incoming asylum seekers, and obviously help protect the population as they come into Arizona and the other points in the Texas and Yuma and stuff like that. So what is your concern, I guess, as far as what that impact could be of them coming in if DHS isn't able to test them and make sure that they're safe from spreading the virus, and how would that affect us here in Pima County?
Lots of ifs there, right, in that question, and many of which we have very limited insight, control over. But I can tell you a couple of things that we understand, and I don't know that this is, and you will need to sort of follow up with the primary sources in terms of what is and is not going to happen. One of the things that we understand from some of the communications that we've gotten from the feds is that there is a process that is being envisioned where people are tested actually before they come into the U.S. And again, that is not something that we own. That is not something that I know any more about, other than the briefs that are being shared with us from the federal folks. But I think that is one of the strategies that is being put into play. Additionally, I could tell you that this isn't our first rodeo in terms of dealing with asylum seekers, and as you will remember, this is an issue that we've dealt with previously. We have really good partnerships with strong community entities that serve these populations, and because of that, we've been planning for what is it that we're going to do should we start seeing a stream of folks coming through that process. I can tell you that, for instance, Catholic Community Services, which operates Casa Alitas in our part of our juvenile detention center, they are prepared because we've helped them become prepared to test all of the folks who are coming into that facility, and to be able to isolate and if necessary quarantine those that may be infected or may be at risk for infection. That is something that we're able to do. This is a very, very complicated thing. There is a whole issue of people being moved through the system, sometimes being warehoused or placed in very tight sort of settings on the federal side. We have no control and no visibility into how that happens or doesn't happen. But what we can have control in is being able to resource our partner, in this case Casa Alitas, to be able to test people as they're coming in so that they can be appropriately managed. Because you don't want to be putting them on a plane or on a bus if they're sick. So I will take the next question.
Thank you.
Next up is Greg Bradbury, and then Jorge Encinas. We have about 15 minutes left, by the way.
Hi, Dr. Garcia. Two quick questions. So earlier you mentioned you can't really make vaccine appointments without the vaccine. Today there were, a number of appointments made at the U of A and a number of other places. Just want to understand, what is that process like of, allocating these appointments when you really don't know how many vaccines are going to be coming? And then also, what is the priority between the first doses of the vaccine and people getting their second dose?
It's a really good question, Greg, and I will not speak for the University of Arizona because I don't have insight into how the state-run pods are being managed with that degree of specificity. I can tell you that we plan on a certain amount of allocation coming through the door, and we plan at about 2 and 3 week intervals, and we will adjust that as it happens, right? The last 2 weeks we've gotten reductions. So even though we had planned for more, we are having to revise those plans. Typically, we are trying to make sure that, and you can find it in Mr. Huckleberry's memo to the board that was part of what was discussed today. Typically, we are doing our very darndest best to protect those second doses. I think when you show up at our clinic and get vaccinated, you are doing so with the expectation that you're supposed to get a second dose at a certain interval, more or less a certain interval, and we are bending over backwards to meet that expectation. The process as it works right now is only allowing us to schedule out so far. Every once in a while, and again, this weather situation may force us to either postpone or delay, precisely because those shipments haven't made it into Pima County. So we manage this resource very tightly. We have no margin, absolutely no margin. In clinical practice, you will usually carry on the shelf a certain amount of inventory. We can't do that. We don't have the luxury of being able to do that. We are burning through our inventory as quickly as we are getting it. And when there are weather-related delays, when they are policy related, as in the reduction from the state, delays or reductions, all those things impact your day-to-day operations. So that's the way that we're doing it, at least in the pods that are the collaborative pods that we operate with our partners in Pima County. Next question.
All right, Jorge Encinas will have our final question in the first round. Jorge, go ahead, please. All right, oh, you were there? Okay, well, we'll move on to Bud Foster with the second round, and then we'll revisit with Jorge.
Dr. Garcia, thank you very much. There's a great debate going on across the country because cases and hospitalizations and such are dropping all over the country, not just here. And the debate is why these cases are dropping. Your opinion as to why this is all happening and happening so quickly.
A couple of things. I actually do think that we've gotten better at recognizing the kinds of folks that need to be in a hospital setting and providing, once in the hospital setting, I think we've gotten better at providing the right kind of support for them. I really think that we are smarter now about treating this disease entity, which back in March, quite honestly, those people were still infected. They were showing up at the emergency department. They just weren't being recognized. They just weren't being diagnosed. We're doing a heck of a lot better job. I think that the immune therapies that have come into play are also kind of game changers, right? So of the folks who are coming in who get it's called BAM, or I call it BAM, but I don't know the long name for it off the top of my head. The folks who are coming into the emergency room at TMC who fit the eligibility criteria for this immune therapy, who are getting this infusion, none of them are requiring hospitalization. In other circumstances, most of those folks would have ended up as admissions, and some of them would have even ended up as deaths. So we're seeing some real positive impacts of that. Finally, I think that there is the co-occurring phenomena that we've reached a certain very high proportion of our population that has been infected at some point. Last time I looked at the state website, and I'll look at it really quickly here. Last time I looked at the state website for Pima County, the percentage of people who had positive antibody tests was at least according to one count has been as high as 40% cumulatively. So we know that people who've been infected will have a certain amount of protection for at least about 90 days. On top of that, now we have almost 20% of our population getting close to being vaccinated. I think all these things add up, and that's why you're seeing the sharp reduction. I'll take the next question.
All right, next up is Danielle Kamara, and then Patty Mackler. We may try to get Jorge's question in if you can email it or put it in the chat.
Hi, so yeah, and you referenced this earlier, but the health department, my understanding is that you guys are pulling back from recommending to schools any kind of formal guidance addressing whether they should be in a hybrid versus virtual. And I was just hoping that you could kind of talk about whether that's accurate and why that is.
So Danielle, just to be clear, we have never purported to be the instructional experts in the room. And our conversations have always been with the superintendents, and I'll tell you that I've been talking to superintendents about this issue since March, since before March. So we've been talking to the superintendents about these issues since before March. And one of the things that we believe is that the superintendents and school administrators are in the best position to be able to know their communities, know the facilities that they're working with. If you don't have the right kind of classrooms to be able to distance kids, then you don't have the right kind of classrooms. They know their enrollment, they know their teachers, they know their neighborhoods. They are in the best position to decide what is the correct level of instructional capability. If you'll recall, it wasn't us, it was the Department of Education said, the State Department of Education and the State Department of Health were the ones that came up with the state dashboard, the state schools dashboard. And that schools dashboard said if you are at a certain level, if you're at a certain level, you shouldn't engage in in-person instruction. Well, unfortunately, what they never planned for rightly or wrongly, neither the state health department nor the Department of Education, is what happens when communities are at a certain point one day and a month later they've been doing fine, they've been operating under a hybrid mode, and all of a sudden the disease indicators are in the severe or substantial spread category. And what the state decided to do, and you'll have to talk to them about that, is they decided that the guidance from the governor's office and from ADHS is that decision that did not require schools to backtrack in terms of their instructional mode if they had the resources and capabilities to be able to keep students and teachers and staff safe. So that has been our position all along, which is schools. What we do for schools is provide technical assistance. What we do for schools is provide resources. What we do for schools is provide context about what's going on. But they ultimately, school boards ultimately, or the governor's office, makes the call in terms of the instructional model that is appropriate for them to deliver. I will take the next question.
All right, next up is Patty Mackler.
So this is just a quick question, Dr. Garcia, please, regarding opening up pre-registration for 65 plus. You'd mentioned earlier that I think you said or indicated the main reason is to avoid confusion with the state sites age range. I just want to make sure that I understood you correctly. And I also wondered if there are other reasons you decided to do this now, especially considering the vaccine shortage.
The main reason, Patty, honestly, is message confusion. So our colleagues up in Maricopa County, the state was operating a 65 plus pods, while the county was trying to stick to 75, and and it was just very challenging for them. And it makes sense, right? I mean, people are. We need to try to have as clear and as consistent a message. And in this case, we are giving in to, for the sake of clarity, for the sake of sending exactly the same message to everybody, that effective on the 18th, folks who are 65 plus are going to be eligible for vaccination. Of course, pending the availability of that vaccine. So I wish it was more elegant than that, but that really is the honest truth. Next question.
Last one is from Jorge Encinas. He sent it through the chat. Are second dose pop-up sites for St. John's and Green Valley still safe from vaccine reductions, or is it just the first pop-up sites being reduced?
So all our pop-up sites, whether they are conducted by our partners, for instance, United Community Health Center had pop-up sites in Oldvale Middle School, Sahuarita High School, Amado, Sopori Elementary School, and Robles Elementary over at near 3 Points. All our second doses are being provided for, are being planned for, and those are not at all threatened. It's what worries me is the first doses, right? So that what that means, given that the amount of stock that we get is finite, what it means is that there may be fewer first dose appointments until the vaccine availability loosens up.
All right. Well, thank you. That concludes our questions for the day. We're going to end this a little bit early. Thank you all for participating, and we'll see you on Friday with Dr. Cullen.
Thank you very much for everything that you're doing. We realize that this is a complex message, and we appreciate your partnership.
All right, thank you very much. Really appreciate it.